A warm welcome to the Monday edition of Our City COVID-19 News Show. I am Michaela Miller. President Cyril Ramaphosa applauds the media for the work it is doing reporting about COVID-19. Who gets major boost in combating COVID-19? And SA Health Minister Zweli Mkhize wants COVID-19 vaccine to be free. As South Africa enters day 67 of the lockdown and day 1 of level 3, the country has 32,683 confirmed cases with 16,809 recoveries and 683 deaths. In the Western Cape, there are 21,103 cases, 11,099 recoveries and 488 recoveries. Informal traders operating at the Grand Parade will be allowed to resume trading. Papers filed by the Legal Resources Centre on behalf of the traders revealed that the City of Cape Town classified the trading at the Grand Parade as a flea market. Weekend, a draft order issued by the court showed the parties are reached an agreement that the operation of informal traders by association. Managers Act regulation traders may now resume working. The fast spread of COVID-19 infections in the Western Cape have been traced back to malls and supermarkets in the last days of the first hard lockdown. Health Minister Zweli Mkhize's special advisor, Professor Salim Abdul Karim, said the number of cases were doubling every 9 days in the province, and that was an early indicator for the rest of the country. Karim said the surge was likely caused by so-called super spreading events. A super spreader, he explained, is an individual who is more likely to infect others compared with a typical infected person. Karim has praised the efforts of the province, particularly in zoning on areas of high community transmission to prevent the outbreak widening. Lockdown has seen philanthropists from all ages and walks of life emerging in response to the crisis. A 13-year-old Rondebosch teenager is one of them. Tam Emery and a group of 3 friends, Daya, Nicole and Kate, used the lockdown to run a small Cinnabon baking and delivery initiative, donating all proceeds to a local soup kitchen. They have raised over 20,000 Rand for Ellen's During Soup Kitchen. In another heartwarming gesture, an anonymous donor donated 2,500 Rand to her initiative, asking that the teens bake 100 Cinnabons for an old age home. It could be at least another month before the Passenger Rail Agency of South Africa, PRASA, was ready to resume servicing commuters. Transport Minister Fikile Mbalula said if PRASA had run like a well-oiled machine prior to the pandemic, the picture would be different. But the service was hollowed out by years of corruption, with investigative journalists revealing on Monday that 9 billion Rand in kickbacks was paid to the Gupta family. Mbalula said his department knew challenges of congestion and safety existed, and that running the service now could see it become a transmitter of the virus. Meanwhile, public transport will no longer have to operate under curfew from Monday. Hikers will be able to return to Sandparks trials, but under the same rules as those for general exercise. Tourism Minister Nkensani Kubayi Nkubena revealed measures to help the alien tourism sector on Saturday, 2 which were to allow hiking and self-drive excursion in game parks. The minister reminded hikers that although they were allowed to travel to and from the hiking destination at any given time, exercise was only allowed between 6 in the morning and 6 in the evening. Hikers are forbidden from hiking in groups and cannot cross provincial boundaries.
Operators, travel agents, tourism information officers are allowed to come into operation during level 3. Again, just to indicate, under professional services will include trainings that do not require mass gathering. So these are, for example, you'd have training for nature guides, which allow safe distances, and also being able to observe protocols. So such trainings will come back to be able to assist the sector to come to life. Public and private game farms have been opened for self-drive excursions. This means many of us will be aware that in nature reserve, for example, if you go to Kruger National Park, you are either able to join a group of tours or you can do a self-drive. So currently, group tours are not allowed. So you are allowed to come with your car, pay at the gate, enter Kruger National Park as an example, and you drive through, you do an excursion within your own province. Hiking is allowed to be done in compliance with the exercising guidelines, meaning you are not allowed to do the hiking in groups. Under accommodation activities are all allowed except for leisure. All establishment will note that since level 5, you have been required to request a letter from the Minister of Tourism to operate so that you can be able to accommodate essential services or become a quarantine. Currently, in terms of permitted services, meaning in business trips, if I as the minister travel into KZN for business traveler as a person who is part of essential services, I am allowed to be accommodated. So that means our accommodation facilities, our hotels, our B&Bs, our guest lodges are operational under level 1 with effect of the 1st of June. We are not required to have letters from Minister of Tourism. What you are going to be required is to keep a list, ensure that people who are coming are not coming into an establishment for leisure purposes. You have to be able to be accountable as an owner of the facility when inspection comes. We will be doing inspection as the Department of Tourism. I know that many people have been confused. You are not required to get any certificate from anyone. We are saying in terms of accommodation, you are allowed to operate. You are not allowed to accommodate for leisure services, only for businesses, permitted services. For quarantine, we continue to follow the guidelines of Department of Health. You will have to have a letter and together approved by Health Department for being a quarantine site. As quarantine, conditions do not change. For accommodation in terms of other issues, in terms of permitted and businesses, that's where the conditions have changed. So with effect of the 1st, no need to request a letter. You have to keep the records. You have to read what we are saying in terms of the guidelines that we'll be issuing and the protocols that we have agreed between ourselves and you as a sector. So we're expecting you to keep to those protocols that we have agreed to. Hunting activities are allowed during level 3. The following economic activities remain prohibited. Conferencing, events, and entertainment activities, such as festival, remains prohibited. We do note that in terms of...
We are now taking a short break, but we will be back with more news. Stay with us. Welcome back. You're still tuned into Channel 263 on DSTV and the Monday edition of the Our City COVID-19 show on Cape Town TV. President Cyril Ramaphosa and the South African National Editors Forum have held a virtual meeting to discuss issues such as broadcasting during the coronavirus pandemic. Here is an excerpt from the briefing. President Cyril Ramaphosa met with the South African National Editors Forum, SANEF, in a virtual briefing. The president commended the media in the role it has played since the outbreak of COVID-19.
You have really helped to inform and to empower the people of our country, but you've also stimulated public debate. But much more importantly, you've also helped to promote accountability and to hold those of us who are in positions of authority and leadership to account for what we do, for the decisions we take, or decisions that we don't take. So we welcome this. However critical it might be of us, We welcome it because we have a constitution that promotes media freedom, and the media plays a very important and critical role in the political architecture of our country. And we want you to continue fulfilling this role. And this time round, you've been fulfilling it under very difficult conditions. And it has also required new ways of working, of reaching readers, listeners, and viewers. And I'm delighted to hear you say that the public of our country has been turning more and more to the various mediums that you have to communicate, and the trust is being regenerated, and we are very delighted with this. This is a time when most media organizations, as you correctly say, are facing real difficult financial challenges. Now, I'm glad to hear that you're having your SANEF forum tomorrow, and we would like you to engage with government on some of these challenges in a, if you like, a particularized way, so that we are fully aware of some of these challenges and see the extent to which, without interfering with the independence of the media, where government can be able to reflect, to suggest, or to even assist. So, Mahlasi, I would welcome an opportunity that you should interact with us, and rather than stay out there and see media houses collapsing, let's have a discussion and see what it is that can be done. Now, like so many others in society, journalists have certainly played their own part in this momentous struggle of overcoming the virus, and continue to do so. Now, of course, we have to pay our condolences to one of your colleagues who passed away. I was very saddened when I heard that your colleague Lungile Tom had passed away. It was a sad moment, but I'm also quite unhappy to hear that there is another journalist who has had to flee the country and go into Lesotho for fear of either being arrested or fear of being dealt with. Now, I'm going to direct the Minister of Police to make sure that he has safe passage back into South Africa, and he should not be molested in any way. And Colin Toba, as you said, I'm going to get the Minister of Police to make sure that he does come back and he's not subjected to any threats, any form of harassment, because, as you correctly say, he was doing his work. And police have no business in interfering with the media when the media is doing, or journalists are doing their work. And as you would be aware, our approach to this pandemic has been informed by the view from the scientific community that most South Africans are likely to be infected by the virus at some point. And you, as the media, have been communicating this very, very strongly and very effectively. And we're particularly pleased about that, because you've helped to spread the message and also make so many of our people aware of the dangers that we face. And let me immediately say that wherever I go, whether I'm walking in the street, on a morning walk, I find that people are either wearing masks and safe distancing. And this has largely been the messages that you have been spreading as the media, and we'd like to thank you for that. While the overwhelming majority of South Africans will be affected by this virus, in the end, many of them will not have symptoms, or some of them will only have mild symptoms. And a small proportion of people infected will develop severe symptoms and will need to be hospitalized. And for a proportion of these people, the virus could also be fatal. And that is the sad part about this pandemic.
Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, held a virtual meeting with various stakeholders about ways in which the global community can help in the fight against COVID-19. SA Health Minister Zweli Mkhize was invited to the meeting.
CTAP is a call to companies as well as governments who develop effective therapeutics to contribute the patent, which would sub-license it to the patent pool.
Since the beginning of the pandemic, science has been at the heart of WHO's efforts to suppress transmission and save lives. Science is moving with incredible speed. Almost every day there is more news about research into vaccines, diagnostics, and therapeutics. But will all people benefit from these tools, or will they become another reason people are left behind? These are the two most important questions. A month ago, WHO and partners launched the SET, or the ACT Accelerator, the speed up the development, production, and equitable distribution of vaccines, diagnostics, and therapeutics for COVID-19. Today, we're joining 37 countries and numerous partners to launch the COVID-19 Technology Access Pool, or CTAP. CTAP was first proposed by His Excellency President Carlos Alvarado of Costa Rica, and I would like to thank His Excellency, the President, for his leadership and solidarity. CTAP is a sister initiative of the ACT Accelerator and offers concrete actions to achieve the objective of the ACT Accelerator, which is equitable access. CTAP has 5 priorities. First, public disclosure of gene sequencing research. Second, public disclosure of all clinical trial results. Third, encouraging governments and research funders to include clauses in contracts with pharmaceutical companies about equitable distribution and publication of trial data. Fourth, licensing treatments and vaccines to large and small producers. And fifth, promoting open innovation models and technology transfer that increase local manufacturing and supply capacity. Through CTAP, we're inviting companies or governments that develop an effective therapeutic to contribute the patent to the medicines patent pool, which would then sub-license the patent to generic manufacturers. CTAP is voluntary and builds on the success of the medicines patent pool in expanding access to treatments for HIV and hepatitis C. WHO recognizes the important role that patents play in fueling innovation. But this is a time when people must take priority. Tools to prevent, detect, and treat COVID-19 are global public goods that must be accessible by all people. Science is giving us solutions, but to make the solutions work for everyone, we need solidarity. COVID-19 has highlighted the inequalities of our world, but it's also offering us an opportunity to bring those inequalities and build a fairer world, a world in which
South African Health Minister Dr. Zweli Mkhize, who was invited to the meeting, says he hopes when a vaccine is developed, it is made available to all people free of charge.
Very much, Excellencies, from South Africa, on behalf of President Ramaphosa, I take this opportunity to congratulate the Director General of the World Health Organization, Dr. Tedros, and the President of the Republic of Costa Rica, His Excellency Mr. Carlos Alvaro Quesada, for launching this important initiative. We also appreciate the cross-regional efforts to realize equitable global access to COVID-19 health technologies as a critical response measure, as now more than ever, the world needs this solidarity and cooperation to pool knowledge, intellectual property, and data for existing and new diagnostics, therapeutics, vaccines, and for the detection, prevention, and treatment of COVID-19. The solidarity call to action calls on key stakeholders and the global community to commit to undertaking actions which are urgently needed to advance the sharing of knowledge, intellectual property, and data that will benefit all humanity. It is also an important complement to the ACT Accelerator, which was launched a few weeks ago, which aims at making diagnostics, therapeutics, and vaccines for COVID-19 accessible on the basis of need worldwide. We'd also like to emphasize the importance of governments and international partners uniting around a global guarantee that ensures that when a safe and effective vaccine is developed, it is produced rapidly, at scale, and made available to all the people in all countries free of charge. We therefore call upon member states and the international community to support the solidarity call to action to promote health and to ensure the achievement of universal health coverage globally.
That's all from the news front, but when we come back, we look at what's making news on social media.
Welcome back. You are still tuned into our City COVID-19 show. I am Octavia Ndlovu. As the search for COVID-19 vaccine continues, many remain skeptical about the herbal remedy Madagascar has started trialing. In this Voice of America video, Africa 54 health correspondent Lenoit Modo spoke to Dr. Ahmed Okwal Omo from Africa's Center for Disease Control and Prevention about solutions for finding a cure.
What about solutions on the continent? What is happening in Madagascar?
Hey, but I butchered the names as usual.
CDC has not really supported this initiative. What is the position of the centers with regards to local solution and particularly traditional medicine, given that it's part of Africa's culture, Africa's tradition?
As Africa CDC, we encourage innovation. Indeed, we know that there is capacity for innovation in Africa, and we are encouraging governments to provide the required environment for innovators to come up with possible solutions. So in the case of Madagascar, we are in touch with the government there, and we are going to look at their data, and also we are going to facilitate multi-center trials so that their results can be reproducible. Whatever we come up with, we are going to make public. At the moment, we are still studying that information, and there is no decision that has been made by Africa CDC yet.
Let's talk about vaccines. Some people feel like Africans are being taken as guinea pigs, especially in this case where there was a controversy with some French researchers. Clinical trials, we know, are essentials in vaccine and treatment development. So how do you regain the trust of communities who are skeptical while ensuring that they are protected in this process?
I think it is important first to condemn in the strongest possible terms those who were recorded and documented to be speaking negatively about Africans in as far as clinical trials are concerned. They do not meet the threshold of scientists, because scientists do not speak like that. Secondly is that all clinical trials that are being done in Africa and we are supporting are meeting the gold standard of doing a clinical trial. They are not only being done in Africa. Each and every one of the clinical trials that are being done in Africa are multi-center based, and the same is being done elsewhere in the world. Those candidate vaccines are safe. Those candidate vaccines are being looked for efficiency and efficacy. We are not allowing onto the continent any clinical trials that do not meet the global standards of safety and efficacy.
Lockdown measures have been implemented around the world, including in Africa. But we've seen in some countries that these measures have had a very, very terrible economic impact.
In the course of next week, we will release a guideline on easing the lockdowns. And this is necessary because, one, Africa's economy is largely a daily bread sort of economy, where people must go out, they must work, and then they earn for the day. There's no reserve for most people in Africa. It is important that this is done in a manner that is good for the country, because you may end up chasing the economy and COVID-19 devastates your workforce. So it has to be done in an incremental manner. Having said that, I must add that the effect of lockdowns is going to be seen in the next few weeks because the numbers are telling a story that it has not been rising fast. The numbers are telling a story that transmission has been slowed down. And this is important for Africa because our health systems are fragile and we cannot afford to have many people exposed and many people critically ill.
There is a concern that reallocation or allocation of resources to fight COVID-19 will put at risk the prevention and treatment of other diseases like malaria and measles. Is the Africa CDC ensuring that other diseases are still gaining the attention that they deserve?
From the very beginning of this outbreak in Africa, we have provided guidance to governments so that the normal health services do not stop. And key amongst those is that governments designate special areas, special facilities for managing COVID-19 cases, and the rest of the health system can be able to continue to do its work around the other ailments and the other conditions that the population is suffering from. We cannot afford to disrupt the normal health systems because it is a danger to society. If we disrupt it, then people will end up suffering and dying from other conditions, not just COVID-19. So our advice to governments is to not stop the other health services, continue with those, designate special facilities to after COVID-19 patients, and in the planning, other health services must still be at the core of the provision of health services.
With the Western Cape being the epicenter for the coronavirus, the Cape Town International Convention Centre has been turned into a temporary field hospital. The Western Cape Health MEC Dr. Noma French Mbombo will showcase the state of readiness regarding hotspot management to the National Health Minister Dr. Zweli Mkhize.
Today, South Africa enters level 3 of the national lockdown. We're here outside the Cape Town International Convention Centre, where Health MEC Noma French Mbombo and Dr. Zweli Mkhize will be showcasing the province's state of readiness. As we do know that the Cape Town International Convention Centre has been turned into a temporary hospital, and we know that the Western Cape has become the epicenter of the coronavirus. This is one of 6 temporary hospitals that the government has put in place, with the Western Cape being the epicenter of the coronavirus. With the Cuban doctors having arrived in the Western Cape, they will be deployed at certain hotspots to ensure that the curve is flattened. 862. That is the total number of beds that have been placed here at the convention center, which has been turned into a temporary facility to treat those who are infected by the coronavirus. On the 8th of June, this facility will be welcoming its first patient. For our City News, I'm Zanele Mvana, Convention Center, Cape Town.
Now let's take a look at the popular hashtags on Twitter today. Hashtag liquor shops. It was with much singing and dancing that the lifting of the ban on alcohol was celebrated outside liquor stores on Monday. While tavern, pubs and restaurants remain locked down, citizens can buy alcohol to drink off-site. Hashtag Angie Muteja. The ongoing confusion over learners returning to school or not going back continues. The Basic Education Minister addressed the media on Monday morning and apologized for announcing a further delay at such short notice. We'd like to know your views on burning issues during the pandemic, so we'll be posting burning questions daily on our Facebook page at Our City CT. You can also follow us on Twitter at Our City CT. That's it from me, Octavian Lovu. Please stay with us. And after the break, Michaela Miller will be giving you information on resources and places of safety you can use during this period. Stay with us.
Welcome back. You're still tuned into Our City, the COVID show on Cape Town TV, channel 263. For your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune into Cape Town TV daily. These are some organizations helping communities stay safe during this period. That's it from the Our City COVID-19 news show, but we will continue giving you the latest news on what's happening in Cape Town on our Facebook page at Our City CT and on Twitter at Our City CT. You can also get in touch with us via email on ourcity@capetowntv.org or call us on 021 448 0448. From me, Michaela Miller and the Our City News crew, enjoy the rest of your week.